I'd like to introduce now Jenni Baker, who has a background in recruitment, rural health policy and research, and has been with DHSV for 3 years. And Jenni's going to talk to us about oral health in aged care. Thanks, Jen.
Thank you. Okay, thanks everyone. Yes, so I'm Jenni Baker, am I too loud? Manager for oral health agencies for the Eastern region. And last year I worked with a couple of community dental agencies around an aged care project, so I've been asked today to talk to you a little bit about that. We all know we have an ageing population. We hear about that a lot. And I think rather than me frame that with a lot of statistics about, you know, the tsunami of ageing people that are coming, I thought I'd just, I did some reading around the generations. So I thought, let's frame this discussion around that, because we often hear about the baby boomers and the Gen Xers and the millennials and what are their characteristics and what motivates them. But I thought, well, I don't know who came before that. So they're the people that are in our aged care facilities. They're known as the builders and sometimes called the greatest generation. These people grew up in the Great Depression. They went to the World Wars. They know about sacrifice, family, loyalty, commitment, and living within their means. They take responsibility. Community comes first. They do things not necessarily for their own benefit, but for the greater good. So it occurred to me, you know, I think actually we're all their beneficiaries. And I think this prosperous society full of opportunity, we can actually thank these people for. So I thought next time we're thinking about doing services to aged care, let's think about it in those terms. So how do I work this? Like that? No? This one? Uh-huh. So why focus on this group? Unfortunately, despite what I've just said, they have the greatest level of oral disease of any population group. They're at greatest risk of reduced quality of life due to untreated oral health disease. What we do know and what our pilot showed was that aged care workers don't necessarily have a lot of knowledge about oral health or the importance of daily oral care. Residents generally, so we're talking about people in their 80s, have chronic disease, disability, chronic pain, cognitive impairment, so are unable to self-care anymore, often on multiple medications, which we actually don't know how they interact. So a very vulnerable group, but also one that we know is maintaining their own teeth. So, you know, 20 years ago, it was a case of oral health to take the denture out, rinse it and put it in a cup and your job's done. Now, if you're working in aged care, you actually need some better knowledge and better skills than that to do your job well. So I'll introduce you to the Better Oral Health in Residential Care. This is a toolkit that was developed in South Australia in 2009 and evaluated by the Australian Research Centre for Population Oral Health Research. So this is a publicly available document, or toolkit in fact, modular-based portfolio. It covers training and education materials for all levels of the staff. So you've got stuff that's relevant for the carers, for the RN or for the GP. And it's practical, it's hands-on. So you've got stuff like handouts, posters, PowerPoints, pre and post quizzes. So our job or our task last year was to pilot this in Victoria to see how that would work. Now, what we do know, if we want to improve oral health in aged care, there are 4 pillars that need to be met. And if we're confident that these are being done, then we can confidently say that oral health of aged residents will be good. So that includes an oral health assessment at admission, which then informs an oral health care plan, which includes a daily oral hygiene, so an actual regime within that plan. The carers, when they're doing the daily oral hygiene, will then feed back into the medical record so that we are constantly knowing whether there are changes or anything that needs to be referred or pain, bleeding, anything like that triggers a referral. So we did a pilot project and we wanted to encapsulate all 4 of those as part of the pilot. We worked with ADA Victoria branch and 3 participating pilot agencies, so they were Goulburn Valley, North Richmond and Ballarat. They all identified one aged care facility to pilot the program with, and we delivered those 4 key pillars. So it's a capacity building, health promotion with a health promoting setting basis. And we took some data and did an evaluation, and their final report was released earlier this year. So what did we find? Let me just say at the outset, it was a small study. It was 3 aged care facilities. Some of the data may be not that representative, but certainly gives us some indications anyway. So the evaluation was based on qualitative and quantitative data, so titanium, collection of baseline oral health data, as well as interviews with aged care staff, and we had 150 in total participate. I've got some quotes directly there from community dental clinicians. Now, when we talked to the aged care facilities, did they understand oral health? Do they practice that? Is that part of their daily care? The answer was yes in the affirmative, absolutely. I mean, they're accredited around this stuff, so they believe that they know what they're doing. As you can see, if you read some of those quotes, that wasn't quite what we were seeing. So we were seeing evidence of poor oral health, we were seeing lack of knowledge and poor practice, and we were seeing lack of skills around identifying disease and trauma. Up here we've got some results around oral health, the oral health assessment, particularly in relation to behaviour and functionality. So we've touched on, or I've touched on, that the aged care workforce necessarily may not have a lot of knowledge or skills, but one of the other barriers in working with this group is a real resistance or reluctance to cooperate. So we're seeing that up there. You're seeing the refusal for treatment, refusal to remove dentures, refusal to open mouth. So look, behaviourally, this is one of the big challenges in working with this population group. When I referred to the South Australian tool, the Better Oral Health tool, there's actually strategies in there to manage some of that. So, as I say, it's a fairly comprehensive tool. Baseline oral health examination. So the blue indicates a healthy mouth. So as I say, perhaps not that representative, some of our data, but we're interested in the reds and greens. But I will point out the purples again. Purples there we're talking about could not be determined. So I'd suggest, again, probably we're seeing there a lot of resistance or reluctance or difficulty with consent. So I think that's backing up again what we're seeing in the data. But in terms of the red, that's telling us where we're seeing changes, and green indicating unhealthy. Some of the leading lights there around oral cleanliness. So 18% classified as unhealthy, so that's evidence of food, tartar, plaque in most areas of the mouth, with 22% showing changes. We're seeing natural teeth, 11% unhealthy, defined as 4 or more decayed or broken teeth, or dentures. Oh no, teeth. Saliva, of course, when you're working, you know, when people are on a lot of pharmacy, using a lot of medication, you would expect to see dry mouth, and certainly we saw that with 22%, and gums 11% unhealthy and 24% changes. So barriers, I've touched on the first part, which is around the refusal to cooperate, and that's around dental anxiety, maybe difficulty to give consent due to cognitive impairment. I'd suggest probably a lot of, with chronic pain, maybe not wanting to go and see a dentist because that might mean more pain. But a really important aspect that came out as well is the access issues. So what we did find out was the aged care facilities don't know that we're there. They don't know that they're in their communities. They don't know that their residents are eligible. they think, oh, well, how would I get the patient there anyway, even if I know there's a problem, where often they did know there was a problem, because they don't know we have portable equipment, they don't know we do outreach. There's a perception that you'd only call the dentist if there was a problem or if a person had teeth. So there's a big piece of work for all of our sector there in terms of making those partnerships. 5 minutes, okay. So key recommendations. So policies up front, so that's around doing the oral health assessment at admission and ensuring that you've got the oral health plan and those 4 main pillars, so embedded in daily practice. Oral health education and training, so this is really key that we're going out and teaching because we know that there isn't that knowledge in-house at aged care facilities. Can I just point out there's a high turnover in aged care facilities, so if you've been in the last 12 months, you'd probably find if you went today that no one would be there that was there for your last session. So it's an ongoing relationship, which then feeds into the next area 3, partnerships and referral pathways. And finally, oral health promotion. DHSV did a sister pilot with this resource and developed resources which are available on the extranet as well. So I'm actually sort of finalising at the moment how can the way forward really around these 4 areas. And that's looking at 2 stages. Stage 1, really a capacity building engagement program that pretty much encapsulates all those 4 key recommendations. And stage 2 is talking about priority access. So look, that's a bit of a longer bow, extending priority access to and establishment of an older adult recall policy. Discussions around this have already started with the department, so watch this space. So in finishing, on our extranet there are resources. So resources, job tools, the aged care toolkit. And basically what you're going to find there is everything you need from the moment that you start thinking about preparing for a visit, service design, administrative considerations, record keeping, engagement strategies, all those training materials. But also we've got maps. So for each of your areas, you will be able to see within your postcodes where the aged care facilities are, some profile of them and contact details. We've also got some leading lights. So there's a number of agencies who are already doing a lot of work in this area, so I'm happy to link you in with those as well, so through the art team. But as I started out, I think really we're talking about the 20% who are in aged care facilities. We know where they are. They're a captive population. We need to start, improving oral health because there's the other 80% in the community that we then have to start thinking about. Thank you.
Thanks, Jenny. There was a lot in that, not least of all. I think I've managed to go through not knowing about the builders' generation or GI generation, so I kind of wasn't thinking there was a different group or a different generation in that aged care facility, so something to unpack. Thank you.